Hello and welcome to the Art of Being Human. I want to continue today what I started last week, and that was about the things that you have to do and the things that you have to carry with you when you're a diabetic. And I wanted to give you kind of a visual presentation so you understand it, both if you are using insulin or if you're not, but you probably will be in the future. You always have to remember that diabetes is a progressive illness, and in that sense, one of my friends says it creeps. But what he means by that is that it gets worse and worse over time. It increases its difficulty over time. So I want to continue with what I started. One hint before I forget it: when you are using these lancing devices and you're checking what your blood sugar is, always wash your hands first before you do it. And the reason is that if you have anything on your hands, like you started picking up a soda and you've got some drops on your hands or something like that, if there's any stickiness or any sweetness of anything on your fingers, when that lancing device goes off, it's going to pick that up. And that's going to be figured into your blood sugar. So your blood sugar might be 85 and it's registering 250, and it's because it has picked up something off your finger as it pricks it. It goes through that and it gets a residue on the needle. So you must always wash your hands first to make sure that it's accurate. Now, what I want to get into also today is the syringes that you're taking your sugar with, that you're taking your insulin with. Here's an insulin syringe. They do come different sizes and different needle lengths. And you'll notice that on the side, I hope you can see this, is a bunch of numbers. Those are the numbers of, say, you want 10 units or 20 units. It's all marked out on the side. So when you draw the insulin in, you can get it exactly to what the measurement is. It has a little cap. You can take that off. You can put it back on, but there usually isn't any real reason to do so. This would be the plunger. This is the cap on the other end. And these caps just protect the syringe from getting dusted stuff in it for sanitation. That's all they're there for, nothing more. You can pull that off. You'd have to pull it off when you use it. Notice the syringe, the needle. I hope you can catch a good shot here of the needle. It's not very long. They do come with longer ones. They do come with shorter ones, but I hope you can catch what that looks like right here. These are very, I think you've got it. Yeah. These are very thin and very pointy and very easily bendable. And for that reason, when you have an insulin shot, there's almost no pain. For the most part, you don't even feel it when you're giving yourself an insulin shot. Once in a while you will, if you do it at a little angle or not straight down, or you happen to hit a blood vessel just right. But for the most part, there's almost no pain at all. You can take insulin shots and it just doesn't bother you. So to take a shot, and usually if you're getting to the point where you're using insulin and using syringes, you'll be given a training session as to how to do it. Now, I'm not going to do that here, but I just want to show you some things. You would take and make sure that that plunger is all the way down to the bottom just by pressing it. And then you would put it in an insulin bottle, which you tip up. Now, there's no insulin in here. I'm just going to stick it in and put the needle toward the middle of that little rubber cap. Then you just draw in, pull on that plunger, and get the amount of insulin that you want. Put it over here. And supposing you need 30 units, well, you can measure out the 30 units. Then you pull it out, put your insulin bottle down, and there are various places on your body where you inject. and your doctor will tell you where. The abdomen is a place, the upper leg is a place, some people use their arms, and there are various places that you can use, and you're supposed to rotate the location so you're not always getting the shot in the same place, because what happens is that area is going to get bruised. Now, it doesn't hurt to have it. You pinch your skin, you put it in, and then you press it all the way down so you get all of the insulin that you're supposed to, and then take it out. That's all there is to it. It's not hard to do. And then what you would do is you would replace the cap on the bottom. You don't want the pointy needle sticking out, and that's all there is to it. Then you're done. Now, these needles are meant for one-term use. So when you're finished using them, you should pull out the plunger, and you'll be tossing that away. When I travel, I have a little bottle. This is just a juice bottle, nothing more than that. But I will take anything that I've used, and I'm not going to use it again, and just stick it in there. Then if I'm traveling, then when I get home, I just dispose of them in the normal way. No one's going to get jabbed on it. Now, the reason for pulling out the plunger, no one is going to be able to use this syringe without the plunger. Let me take off that cap for a minute. You have a syringe with no plunger. There's no way to get any substance in, say if a person was a drug addict and they found it, and there's no way to get anything out of it. You can't, when you pull in your insulin, it's almost like a suction. And when you push it back down, then you just forcibly put the insulin in your body. You take it out, you take the plunger out, you throw the plunger away. You could throw it anyway. No one's anywhere. I mean, you can put it in any garbage, any wastebasket. No one's going to get hurt on it. But this insulin syringe now cannot be used at all. And that's what you want. There are some clips that you can use to clip off the needle, but I read in an article last night that you shouldn't do that because they fly off and they could hit you and injure you or hit somebody else. No one's going to use this anyway. They just can't use it. And so what you do with it after it's done, and I need to explain, these syringes are made for one-time use. A lot of people use them longer than that, quite a bit longer than that. And it's the same with the lancets. They're made for one-time use because now it's medical waste. If you, for the lancet devices and those little tiny lancets, they prick you, so they've got blood on them. And you just toss it away. The insulin, the lancet devices you can use over and over and over again because you can put any number of lancets in them. They fit, they're interchangeable. You could just keep using it for weeks and months and years if it continues to work that long. But the lancets themselves are very cheap. There's no reason why you can't use it just one time. But the syringes can be fairly expensive. And so people tend to use them over and over again. And I understand the financial consideration, but this is what you have to consider before you decide to use it more than once. You cannot, it is wrong to mix insulins. You can weaken the effect of the insulin or destroy the insulin if you mix the wrong kinds of insulin together. The pinpoint needle on it will get roughened up with continued use. They're so thin, they're so tiny. That's what makes them practically painless. But it's easy if you overuse them that this is going to get roughed up and it's going to be rough. And what's going to happen is that the insulin shots will become more painful. If you are using them more than once, then you've got to realize that if you're having pain, it's because the insulin, the shots is damaged, the tip, because of its tininess. And that can happen. It's also easier to get infections. It's also easier to get bubbles in what you're taking in, and you're constantly tapping to get the bubbles out, because if you're getting air, you're not getting your medication. It's not going to hurt you, but why not get the medication that you need? And so therefore it's better for one-term use. I do understand the financial constraints of needing to use them more than once. If you needed to do that, at least change the syringe every single day. Don't use use a syringe for more than one day. It's better for one-time use, but if that's not possible, at least change the syringes every day. Otherwise, you can get a terribly bad infection in your blood, and that's something that's hard to get rid of, feels terrible, and you just don't want it. So I just want to point out that. Now, how do you get rid of it? Well, there are various ways of getting rid of it. The expensive way or the cheap way. When you get the insulin thing and you're done, I guess I won't use that. You put them in a container like an empty laundry detergent container, because the plastic is thick and you can't see through it. And you just do that until it's filled. And then what you do is you close it tight, and then you wrap it around with tape very thoroughly, and then you label it, used insulin syringes, and most times you can take them to the dump. Most apartments do not allow you to throw used insulin syringes, even if they're contained in some kind of a plastic container. They do not want you to put them down the chute of the garbage chute. As a matter of fact, they can get so strict about it that if a garbage man even sees a syringe, they can just refuse to pick up the garbage, because they don't know if someone's had AIDS. They don't know if someone has a communicable disease or a sexually transmitted disease, and they don't want them down the chute. By doing this and taking them to the dump, they're contained and they won't wiggle out of it, and a drug addict won't be able to see what's in it, even though it's labeled. Now, you cannot use like milk jugs or soda bottles or clear liter bottles or anything that you can see through, because it's not thick enough. The plastic is not thick enough, and you can actually bend it. If you looked, I was looking at a couple of milk jugs, milk bottles. I was going to bring them in this morning and decided against it. I had too much to carry. But I could take my hands and I could bend an empty milk jug. I could actually bend it in. So it needs to be thick, because if any of these slip out, these pointy needles can work their way through the plastic, and you don't want that. You don't want anyone getting hurt on them, and you don't want to use any container that you can see through, because if you can see through it, then a drug addict can see through it too, and it's a case of keeping drug addicts from using used insulin syringes, which would make them sicker, so you should just never use it. Now here's an opaque jar. I brought it in. The plastic is thick enough. There's no problem with the plastic being thick enough, but the size of the top, the cap, is too narrow. It's very hard to tape it. Once you get the insulin syringes in there, you tighten this as tight as you can take it, and then you wrap tape around and around and around it so it won't have any chance of coming off, even though it's very tight. But this is hard to do because of the fact that it's not very deep. So this would not be a good candidate, except for the thickness of the plastic. Now, another way to do it is to use a Sharps container, and I need to explain that. Here we have a Sharps container. It comes in a box. You can buy them at a pharmacy, and there are two boxes in there. There's the box that it comes in, which was this one that it came in, needle collection disposal. I got it at a drugstore. And then inside that box is this box. It's a Sharps container box. This is what you'll send it in through the post office to the company that makes the Sharp containers. It's a biohazard box. It's acceptable to the post office, but there is a cost to it. So you get your needle collection device. This is Sharp's container. And you take the plungers out, you put them in. It has this odd-looking top to it. Once you get it full, and I believe it's supposed to be able to hold about 200 syringes. That's what I think it is. Once you close this off, I'm not going to close this off in case I ever have to use it again. No human being can open it. It is closed forever. No matter how hard you try, you cannot open it. And then you put it in the shop's containers box, send it through the post office to the company that deals with them, and then they take care of it from there. The shop's container costs about $7. And then there is a cost when you bring it back to the post office, and they send it back to the company that makes the shop's container. I don't know what that cost is because I've never done it. I just, for most cities will allow you to take some kind of a device like this. The bigger ones are probably a little better because they hold a lot more. And they allow you to just dump it in the dump. There's a certain place where you put them. And I know this city allows you to do that. And there's no cost. You just take a container you already have and get it filled up and tape it shut, make it tight, and then label it. Then you're all set. So that's how you take care of that. Now, there are a lot of little things that I want to tell you about. I have enough time to tell you some things here. Let's see, get to a certain point. Shops, containers. I like to keep things in cases. It's easier to carry things in cases. So what do? Here's a case. I have in it 2 or 3 empty syringes. A small case like this can hold about 4 syringes in it. And then zip it up, put that in a larger case, and add syringes to it. You know, I have done that already. And then you have your insulin and your syringes. You can put some tissues in it. You could even fold up a log paper if you wanted to and add a pen, and you've got it all together in one unit. Then all you have to do is put it in one of these little coolers. Look at the inside. It's a cooler. This is a cheap one. You probably want to get one that's more expensive. And then what have you got? You're all ready to go. You fold this up, close it, put it in your purse. And what have you got? You've got your insulin. You've got your insulin syringes. Anything else you want to put in there. Plus, you also want to put in an ice pack. If it's during the summer, there's enough room in here for an ice pack. That'll keep it cool. Fold it up, stick it in your purse. Why do diabetics carry such large purses? They've got to carry all of this stuff around with them. So just with a smaller case, I could take as many as 4 types of insulin or 4 vials of insulin and several syringes. Now, if I use a syringe once on a one-time use, I've got to have at least 5 for one day. But sometimes you need a lot more of that. You hit a bleeder and you get some blood out, then you have to throw the syringe away. Now, instead of throwing it away when I'm on the road, I take the plunger out and put it back in the case, and that tells me I'm not going to use it again because there's no plunger in it, and then use another one. So you have that, and you have pretty much all you need. What I have in here, a little case, is a group of syringes and lancets. I can stick a bunch of lancets in there too. So they're all together. Another little case taking care of that. Well, then what's this little case? This little case would have all the medications that I need. Now, if you're traveling, you really do need to carry all of this stuff. I know you can pack it in a cooler and you can pack it in some kind of a case that you bring with you, something that's like this here. You could carry it in, but I never let the syringes or the insulin or the medication out of my sight. It will be packed with me in my purse that I carry with me. Because supposing that you're traveling, and supposing that your luggage gets stolen, Or you put your cooler down, and since you have your purse, you forget to take the cooler with you, because after all, you're carrying something, so therefore you assume you've got everything in it. You could lose your insulin. It's much better to have it actually with you. Now, this is a better quality one. And when I put in an ice pack, I usually put the ice pack in some kind of a case that it'll fit in, because I don't want it directly on what is carrying my insulin bottles. I just think it's easier to take care of that way, and it makes it a little cleaner. But you can put in so much stuff. Stick these in your purse, your ice pack, and everything else that you have with you that you need to. And then in a separate cooler, carry something like this, because that's going to take all of the things that you're not using anymore. That's if you're traveling. I wouldn't carry this around town. If I were just going around town, I would take my measuring devices, so I know what my blood sugar is, and I have a case for that, as I showed you before. If I have it here, I don't know where I put it, but you have a case for that, and then you have a case for the insulin, and you have a case for the syringes and medication, and it's kind of all together. But if you're traveling, consider this: you should be taking at least twice as much medication as you think you need, especially if you are traveling overseas. If I were traveling, say, just to the Midwest, or if I take a trip to Ohio to see one of my nieces, I'm going to take at least twice as much medication as I need. What if I dropped one of these bottles on the floor, and I got clumsy or something, and it broke? I've lost a 10-day supply of Humulog, and where am I going to get it if I'm out of state? I think what you also need to do if you're traveling, you need to have a list of all your medications, their refill numbers, and maybe even take the original prescriptions with you. If you are traveling overseas, of course you're going to have all your medications with you. Take at least twice as much as you need. Now, with the insurance companies as they are, they're not going to give you any more than a month's supply, because that's what the prescription calls for. So you're going to have to go to your doctor and say, I'm going overseas and I'm going to be gone for 3 weeks. Let's just say, I'm going to need to have more than a 3-week supply just in case something happens. And he will have to write you a special prescription, which they will fill. But to say, I'm going to go overseas, fill this prescription 2 or 3 times, they won't do it. They have to have an order from the physician for that. And that protects them, of course, so you don't get too much medication. So it is a hassle to travel overseas with medication. Keep the medication in cases with you. Don't just put it on the side or put it in a cooler. One thing I do during the summer, and I think it's fascinating, if you're a woman, maybe it'll be helpful. But here's another case. Makeup cases, pencil cases, they all do very well. This is a cooler. It's one of my favorite ones. And what I do during the summer, I can take the top and unzip it. Whoops. And I can put, this is what I want right here. I can put an ice pack in here. It'll fit very nicely. Close it, zip it up. And then in the front, I have this right here. It can act like a wallet in the front. I mean, it's big enough in there so you can put in a credit card, money. You wouldn't be able to put in maybe a whole wallet. And you could take care of it that way. And then you could also put your diabetic supplies in the inside. Well, I can see I'm running out of time again. I may come back for one more segment and finish this up, because I have a little more I want to do with it. So we'll do that next time and finish it up next time. So please join me next time.